This revision PowerPoint focuses on World War I and World War II. The focus this time will be on what happened in World War I and World War II in terms of progress in medicine, particularly in terms of surgery, and we'll have another look at the key individuals of Gillies and Mackindo. Before we look specifically at World War I and World War II, it's important to remind ourselves of the impact that war has had on medicine over time. It has both a positive and a negative impact on both surgery and health over time. So one of the key reasons why war is sometimes a help in terms of the development of health in the people is because the government during a war have to pour an awful lot of money into getting injured soldiers better. That often leads particularly to advances in surgery. Doctors and surgeons also have to work much harder. They're working under pressure. That's not saying that doctors and surgeons don't usually work hard, but the pressure is so much greater on the battlefield, and they are reacting to new and different situations that often new ideas and new techniques are developed, and that's happened throughout the whole history of medicine through time. There's also more opportunities that wouldn't come up under normal circumstances for doctors and surgeons to test out and practice new ideas, things they might not get to experiment on during normal times. However, war is also something that at times has held back the development of surgery and health. One of the key reasons for that is that actually during a war, doctors are taken away from their everyday work. They're not doing their normal research, they're not doing their normal surgical procedures, and therefore developments that might be made in one particular area aren't actually made during a war because the doctors are too focused looking after injured soldiers. And that's linked to the second reason why war sometimes hinders the development of medicine over time. Lots and lots of scientists are taken away from their usual medical research, and therefore countries are concentrating everything rather than looking at stuff like cancer research. They're looking at developing particular methods to cure certain wounds. Just as at the moment, lots and lots of medical research is focused on finding a vaccine for coronavirus. During war, medical research is tunnelled down one way. Also, warfare disrupts everyday life. Places like library, places of learning are often lost. If we think about this crisis in places like Syria in recent years, what that's meant is that huge amounts of historical buildings, but also centres of learning have been destroyed. And that again has happened a lot over time. So war is something that does lead to a huge amount of discovery and a huge amount of progress, but it's also something that disrupts, and we must keep that in mind as we're looking at both World War I and World War II. Now, we've looked at this all very, very recently, so I'm hoping that this is going to be really familiar to you. When we think about World War I, we really do think about a number of really, really big advances. And there's 6 particular areas that we're going to have a look at. The first one is shell shock. Now, hopefully most of you can remember that shell shock was seen to be something new in World War I. This was where soldiers could have panic attacks, they might shake, they might not be able to move or speak. Now, at the beginning of World War I, when the soldiers were first in the trenches, 1914, 1915, and they were reacting in this way, many people had never seen this kind of reaction, and therefore the British Army treated people who were actually suffering from shell shock as cowards. They were seen to be people who were refusing to follow orders, and there were instances of people suffering from shell shock, of them being taken and being shot as deserters, as cowards, as people who were unwilling to cooperate with the war effort. However, as those cases rose into 1916, following the Battle of the Somme and things like Verdun, and into 17 and 18, there began to be more understanding that this was something real, because it was happening time and time again. Therefore, World War I is a time where there was a beginning of an understanding of the condition of PTSD, or post-traumatic stress disorder. So when we think about World War I, we think about it as being a time where the beginning of real awareness of mental illness caused by war was actually in its infancy and beginning. So World War I is really important in shaping our knowledge of that. Another reason why World War I is so important in terms of medical advancement is because of blood transfusions. Well, blood transfusions have been being used for years, for centuries in fact, but it wasn't until the year 1900 that scientists really worked out how to do them successfully. And that was because of the work of Landsteiner. Well, he discovered blood groups, and that allowed doctors to understand that actually the only way that a transfusion was really going to be successful is if the donor's blood type matched that of the receiver. Up until that point, it was just luck whether a transfusion worked because they didn't know about blood groups. But from 1900, they did. However, there was still a problem, and the problem was to do with storing blood. If blood is exposed to the air and stored, it clots incredibly quickly. So at that point, it can no longer be transfused. So up until World War I, yes, we knew about blood groups and we were able to do patient-to-patient transfusions. That wasn't very practical in a war situation. So in 1914, a Belgian scientist called Albert Austin, and that's how you say his name because he's Belgian, he's not British, he discovered that glucose and sodium citrate, if you added them to blood, they stopped the blood from clotting on contact with the air. That meant it could be stored more easily. There was also solutions around bottling, packing, and making sure that surgeons had access to blood on the battlefield. Now, this is an example of what I was talking about on the very, very first slide where we were talking about how war helps or hinders the development of medicine. The need for blood in World War I was so acute, so massive, that those solutions were made much more quickly than they would have been in different circumstances. So war helped push forward a discovery that would have been made anyway, but it was needed far more than it would have been needed at any other time. Another kind of linked discovery was that of X-ray. So just like blood transfusions, X-rays have been around for a while. In fact, since 1895, so almost 20 years before the outbreak of World War I. And hospitals were now used to using them, not only to see where a break was on a bone and look at how to actually treat that broken bone, but also to see, early diagnosis of disease within the body. But it was the First World War where X-rays really became incredibly important. Mobile X-ray machines set up in these kind of wagons, these vans, were used near to battlefields to find out exactly where in the wounded soldier's body the bullets or pieces of shrapnel had lodged. Now this was vital. After the artillery bombardments over the trenches, these shells were splitting up into all of these nasty metal pieces, and they were all over soldiers' bodies. What the X-ray machines allowed to happen was surgeons to very quickly and easily locate the shrapnel and remove it. And what that meant was less invasive surgery for the soldiers and a much better chance of a good outcome. So that's already 3 incredibly important developments in World War I. One of the advances that I'm sure you remember, and this is linked to one of the key individuals that I hope you've been looking at on one of the other narrated PowerPoints, is in plastic surgery. So during the First World War, the hard work and dedication of Harold Gillies, the London-based army doctor, led to the development of plastic surgery. Essentially, what he did was he set up this special unit to transplant or graft skin and treat their severe facial injuries and their wounds. Now, we saw lots of pictures of this as we studied this in the lesson, and we saw how soldiers lost their jaws, they lost parts of their noses or whole halves of their faces. And without surgery, those soldiers would have had very, very little chance of life at all, let alone a normal life. So Gillies' work was vital in handing them that lifeline. So what Gillies did was he opened up this special hospital in Kent, and what it did was it provided beds just for these soldiers with severe facial wounds. And by 1921, they had treated over 5,000 men who had served in World War I with their facial wounds. So this was a completely new development, something that would not have happened without World War I. So some of the developments we've seen have been things that potentially would have happened at a later date, but perhaps not as quickly as it did. There was no need for these kind of facial reconstructions without the horrors of World War I. So this is something definitely pushed, not only by a key individual in Harold Gillies, but also by war itself. Another area that was developed in World War I was that of infection. Well, there'd been problems with infected wounds for centuries, ever since there had been operations really. But battlefields in particular caused horrible infections on wounds, particularly with things like gangrene. They were common and often led to soldiers losing entire limbs, often having to have amputations, or actually dying through the blood poisoning caused by these wounds. Through trial and error, what surgeons worked out on the battlefield in World War I was that actually the best thing to do was cut away as much of the infected flesh as possible and then soak the wound in a saline or salty solution. Now, this wasn't perfect and didn't have a 100% success rate, but it was certainly better than what had come before, and it did save many lives. Again, this was something that would have been worked on and discovered over time anyway, but the First World War sped up this knowledge of how to deal with severe infection. Finally, broken bones have been dealt with over centuries and centuries, in fact thousands of years. But new techniques were developed in World War I to repair broken bones, based on other techniques from the past. But essentially, things like the army leg splint or Keller Blake splint was developed. What this did was it held up the soldier's leg into the air, extended it. This is called intraction. And it helped the bones to knit together much, much better than any previous method. And that splint was so effective that it was still used today. So they're the key 6 developments in World War I. So we're quickly going to zoom in now on Harold Gillies. So just like we saw on the medieval narrated PowerPoint, hopefully you've had a look at that, Hippocrates was known as the father of modern medicine. Harold Gillies is known as the father of modern plastic surgery. And this is because the trench warfare, the modern weaponry caused these horrific injuries. As I mentioned before, the metal tearing through the flesh, creating twisted wounds or ripping off entire faces. These prevented men from living normal lives. Gillies was horrified by this, so he set up firstly a special ward in Aldershot at the Cambridge Military Hospital, and eventually he set up the Queen's Hospital in 1917. What he also did was he made sure that he was selecting the right candidates. He sent out men to go and actually find victims of these horrific injuries in field hospitals in France and get them sent directly, firstly to the Cambridge Military Hospital and then to the Queen's Hospital. In total, he dealt with over 5,000 of these servicemen. So he was so significant because he was this pioneer, this first person to really try this transplant, this grafting surgery, the foundations of modern plastic surgery. And some of his techniques are still used in reconstructive surgery today. Cosmetic surgery grew out of this. And whether you agree with cosmetic surgery or not, it is a massive industry today. And it was all about wanting to restore that normal appearance. And that was seen to be, by Gillies, really important. And it hadn't really been before. Also, what it gave men was that lifeline, that chance, that second chance at a normal life. And of course, another reason why he was really influenced is how his work was then built upon in World War II. So a quick link now between the two in terms of introducing World War I into World War II. So World War I, if you know, sped up developments in surgery, health and medicine that probably would have happened anyway, such as blood transfusions and such as X-ray technology. World War II, really, really similar. Lots and lots of techniques and medicines that were already out and about were pushed forward because of World War II. So we saw in World War I, there were 6 real developments that I wanted you to remember. It's exactly the same in the Second World War. There are 6 main areas where advances were made in this Second World War. A real link to the First World War is to do with blood transfusions. So in World War I, we'd seen how now they'd understood blood groups and they'd started to understand how to store the blood. Well, in Second World War, they made even greater advances in the storing of blood. It was now able to be kept fresh and usable for longer. That was particularly important in far-flung fields of battle over in Africa and over in the Pacific with the American servicemen. There was also massive blood banks developed in the USA and Britain during World War II. People were encouraged to give blood, and that hadn't happened in World War I. So we've got a great advance on something that was already there, but again pushed forward by the Second World War. Another area that developed at this time was heart surgery. At the start of the PowerPoint, I talked about how what war sometimes does is it gives surgeons and doctors the opportunity to experiment. And that's exactly what happened in the Second World War. An American surgeon called Harkin cut into beating hearts and used his bare hands to remove bullets and bits of shrapnel. Again, he knew where things were due to X-ray technology. And what this led on to was heart surgery following the war. Much of that technology and much of those discoveries would have been made, but because there were so many internal operations carried out in World War II, there was greater confidence in carrying out heart surgery moving forwards after the war. A real link again to World War I here in terms of plastic surgery. We're going to look more at Mackindo in a second, but Mackindo, a cousin of Harold Gillies, used new drugs such as penicillin to prevent infection when treating pilots with horrific facial injuries. Again, he was there reconstructing surgery, particularly faces and hands, and this was respected all over the world. The next areas are a little bit different to what was done in World War I. So one of the key advances that came out of World War II was the NHS. When World War II broke out, the government increased its involvement in medical care. There had already been those liberal reforms from 1906 to 1914. We had national health insurance, where workers were able to pay into a scheme. But in 1942, the civil servant named William Beveridge wrote a report where he proposed a free national health service for all, not just for workers. It didn't have to be that you paid into it. It was going to be there for every member of the British public. And this was sped up by war because people saw the commitment, or the government saw the commitment of the British people and decided that actually they deserved healthcare on a national basis. And the NHS, of course, came out of that in 1948. Another health-related advancement from World War II was on diet and poverty. Now, we'd seen lots and lots of reports and issues with diet and poverty right the way back into the 1800s. We'd seen the reports by people like Chadwick, and then later by Booth and Rowntree, and then, of course, by Beveridge in 1942. But during World War II, people's diets improved because, this seems strange, there was a shortage of food, but people were encouraged to grow their own. People growing in their small front gardens and yards. Any bit of ground where food could be grown was turned over into something productive. And it meant that people were used to having their own vegetables in particular. And this did improve people's diets. When children also were evacuated to the countryside, it revealed mass poverty, and that links to the NHS as well, and it links to the Beveridge report because the government was then committed to sorting things out afterwards. A final area of World War II was around drug development, and this can be linked to World War I. Fleming, who developed or who came up with penicillin in the first place, he'd seen the waste of life in World War I, how so many soldiers had died of infections, particularly from staphylococci, and what he decided was he needed to find something to fight that infection. So for 10 years following World War I, he experimented, trying to find something that would fight that infection. And eventually in 1928, he discovered penicillin. This was the first antibiotic, but the reason why it's linked to World War II is World War II is what really pushed it into production. Florian Chain had worked on it at Oxford University in the 1930s and had experimented and worked out that actually it did fight infection and it could be used to save lives. But it wasn't until the Second World War that the British and American government really started investing in penicillin. So the British and American governments realised how important this new wonder drug could be in curing infections in deep wounds. And so the American government in particular invested $80 million, gave that to 4 drug companies, and that was then put into production for the Allied forces. Afterwards, it became something used by civilians. Penicillin would have been developed anyway, but just like some of those other advances that we've seen, its development was pushed forward because of the urgent need for it during World War II. So we'll just have a quick look at Mackindo now. So he became incredibly famous for his work with fighter pilots in the Battle of Britain. They'd suffered from horrific burns, so slightly different to what had been going on with Gillies. Gillies had been particularly working on soldiers where their faces had been blown off or ripped off. What we've got here with Mackindo was treating really severe burns. In the Hurricanes and Spitfires, the main fighter planes of the British, they contained highly flammable liquids in massive, massive quantities. And it could be used as fuel, of course. But when a plane caught fire, which happened when they were hit by the enemy, they spread very, very quickly. And the pilots inside were the ones that really suffered with those burns. So the pilots were named as the guinea pigs, as the work was being done to them was so new. Nobody was sure that the operations would be successful. Again, it was all based around skin grafting, and it was building on what had already been done by Gillies in World War I. Mackindo as well took it to the next level. He didn't just work on the physical appearance of the pilots, he also worked on their psychological rehabilitation. There is also a little video clip on here that you can look at in your leisure later on. So why was Mackindo so significant? Well, he was significant because, again, he treated large numbers of men, 649 men who would have been really, really disfigured by their scarring, were able to live a normal life again. He was awarded a CBE and a knighthood by the British royal family. His techniques have been used for many, many years. They've also helped servicemen in modern conflicts, things like the Falklands War, things like Iraq and Afghanistan. Those early original methods that he used have of course been perfected and improved over the years. But that's also because he developed these institutions where plastic surgeons could be recognised and learn and share their craft. There's lots of similarities between World War I and World War II. One of the key ones is that development of plastic surgery, the roles of both Gillies in World War I and Mackindo in World War II. One of the key things that we've looked at as we've been going through this PowerPoint together is that it led to some other new developments, things that were completely new that came out of both wars, such as shell shock and the real development of heart surgery. But really importantly, both of the wars sped up developments that would already have been going on, such as blood transfusions and x-rays in World War I and penicillin in World War II. So both of these wars led to massive advancements, some completely new, some that would have happened anyway. And you need to have a good understanding of the similarities between those two wars and what was perfected in those wars or what was completely new. So just like with all of the other narrated PowerPoints, it's down to you now to use the information and make some revision resources. It's essential that you have a really good understanding of what happened in both of the wars, what new developments were made at these times, what was worked on and improved, and also the similarities between the two wars.